my parents used to share a lot of reels and memes. If you drink this, cancer can be prevented. If you do that, cancer can be prevented. So do you have any thoughts on that?
The modern day chemotherapy often cures. It doesn't. But all I would advise the patients is that talk to your doctor before you take a lot of these. Often a lot of the information you get on the internet is unproven.
Some signs you have noticed, and how frequently has that been, to observe a caregiver burnout? Because, this is very common in a cancer journey.
The husband and the wife or the spouses are going through probably the most stressful time in their life. And when you're under stress, who will you take it out on? It's typically your loved ones.
So how do you think, like a caregiver can maintain a balance between their personal as well as professional life? Professional is definitely needed because cancer is a disease which requires a lot of financial resources.
The oxygen mask come down. First secure it on yourself and then secure it on the child. You have to take care of yourself so that you would be able to take care of your loved ones better.
Me and my father were the one who were visiting the doctors and, talking to them, understanding how the criticality of the disease and, how terminal it is. Dr. Milind Javle is a professor in the Department of Gastrointestinal Medical Oncology at the University of Texas MD Anderson Cancer Center, is renowned for his research and clinical expertise in gastrointestinal cancers. Dr. Javle's work focuses on innovative therapies and has led numerous studies that have advanced the field of oncology, particularly in understanding the complexities of biliary cancer. We welcome Dr. Milind Javle to our first ever in-person podcast. I think I'll go ahead with the first very question that has come always in my mind. Dr. Javle, what is your vision which aligns with our initiative? What motivates you to contribute to this field of biliary cancer? Can you please us with that?
Thank you, Priyanka, first of all, for your kind invitation. So, Priyanka, when I came to the US after my medical school in Mumbai and I was looking for a specialty, oncology attracted me. One, because oncology was an area of great unmet need. Even within that field, I felt GI oncology and especially biliary cancer, no one was really studying it in a committed way at that time, to my knowledge, in the US. Of course, there was a lot of innovative work going on elsewhere in the world. Plus, biliary cancer, especially gallbladder cancer, is an important problem in my own country, in India. So that's what attracted me to this field. So when I got to know about your work in this area, stemming from your personal experience, it was very inspiring for me, because my vision here is that patients get educated about this cancer. We remove the stigma of the diagnosis of this cancer. We are able to treat these patients effectively. We give patients hope. And together we find novel therapies. And this is only possible if we get the message across. So therefore, your vision in this disease closely aligns with mine.
Thank you, Dr. Javle. I still remember how vaguely I connected with you over an email last year, asking you to help with my mother's treatment journey, and you were more than happy to give your medical assistance over there. So I'm glad that we have doctors like you who are contributing to the field, which is still unexplored. Next question would be, how does the type of cancer influence the treatment approach and prognosis?
So first of all, for the audience, I want to describe what cancer is, and I'll explain it in a very simple way as much as I can. So, cancer is unregulated growth of cells. So cells that can be anywhere in the body because of abnormalities in the DNA grow in an unregulated manner, both locally and systemically, so they can spread beyond their site of origin. Treatment for cancer often depends on the site of origin. For instance, if the cancer occurs, for instance, in the lung, then, the treatment would be directed towards treatment of the underlying lung tissue, removal of the tissue, and then preventing its spread. So this is sort of a broad way of describing the cancer and its treatment. I think you also asked me what caused the cancer, and we clearly don't have all the answers as yet. But we believe that it is a mixture of genetics and environment. So there's some abnormalities that occur in the DNA, which some of it may be inherited, some of it may be because of exposure to the environment. So these DNA abnormalities then eventually lead to unregulated cell growth and cancer. So this is a long process that takes years and years to develop in some cases. And it will be wonderful if we can find clues to its mysteries for its origin and early detection and prevention.
And like given in today's era, everyone's lifestyle is extremely hectic. So I certainly believe lifestyle is one of the very triggering element which can cause a lot about make a lot of impact on your health. So what are your thoughts on that?
So I think, Priyanka, you stressed it very well that our modern lifestyle, where we spend very little time really looking after ourselves, we are always in a rush to get somewhere or the other, meet deadlines and so on, couldn't help. And I can tell you how many patients I see who have gone through some major emotional trauma, a loss of a family member, a divorce, or some other, and then, following that, they get a difficult diagnosis. So it's really a question of how the mind and body interact with each other. And this is certainly even a more complex area for which we certainly need young people like you to invest your energy in.
So, I mean, as we see in today's era with the trend of Instagram and YouTube, there have been a lot of myths floating around about cancer. Do you have any specific myth which you would like to debunk with us? Especially in countries like India, I have seen so many, like my mother, my parents used to share a lot of reels and memes. If you drink this, cancer can be prevented. If you do that, cancer can be prevented. So, do you have any thoughts on that?
So the first important message I have for people is let's not treat this as a stigma. Let's not be scared of the diagnosis. I see patients and their families come to me, especially Indian patients, where we are so afraid of the diagnosis that we don't want the patient to know, we don't want the family members to know, and that sort of thing. And that doesn't help. We have to remove the stigma so that we can address this disease better. Now, you mentioned specifically, Priyanka, about the myths that exist, and in today's era of information technology, I think this is a mixed blessing. One is that patients have access to a variety of resources that they didn't have before. So it's always good to go to a valid resource coming from the Indian Cancer Society or coming from the National Cancer Institute, avenues where you know the information is properly vetted. But most of our patients are often on some sort of alternative therapy, whether it's herbal therapy, Ayurvedic therapy, homeopathy, or other, different medications out there. And I don't really discount any of them because it's not like the modern day chemotherapy often cures. It doesn't. But all I would advise the patients is that talk to your doctor before you take a lot of these. Often a lot of the information you get on the internet is unproven. Like my uncle had cancer and he took this something, jari booty, and it's gone. This is not validated type of resource. So look at it critically, and then by all means you can try something if you're going to discuss with your medical team. Because if you don't, there's a possibility these may interact with what therapies you're getting, so it may be counterproductive.
Thank you. I mean, I totally understand your viewpoint. And, as a personally, I have been a caregiver myself, and I understand a lot of other caregivers go through this, stigma in their head that they should not disclose about any kind of alternative therapy they are putting their loved one through when they are undergoing chemotherapy, because the doctor, their oncologist, will completely say no to it. But, your answer gives a clear, vision on, how the particular treatment line should be aligned well, and everything should be disclosed in front of the oncologist, who is the primary treatment person for the loved one. So now I would like to stress upon the role of a caregiver in the cancer journey. We do understand cancer is a family battle, and altogether the entire family, especially the primary caregiver, is battling the most. In my case, when we were undergoing our journey, my entire family, my dad, me and my brother, we were struggling to, keep up with everything. So, I just wanted to understand what should be the role of a caregiver in deciding the treatment process, because sometimes people say the treatment decision should be a patient's call to make. Is it a patient's call to make or a caregiver's call to make in terms of dealing with a terminal illness?
So I think this is a very important area that you touch on, Priyanka. We have never traditionally thought much about the caregiver. We always think about the patient and his treatment. Well, the reality is you can't really affect a treatment that is going to work for the patient unless you know that the patient is getting appropriate care. And you also, in a way, take care of the caregiver. So how could we do that? And let me give you an example from my own practice. Back when I was training, it was a very busy clinic, a lot of patients there. and the patient couldn't come, but the patient's spouse came for the meeting. And the way the clinic system is run in the US, you can't really have a clinic interview with the spouse because there's, coding, billing issues, etc., etc. And then that lady told me something that I still remember today. So she said, well, remember that it's not just my husband who's going through it, but all of us are suffering from cancer. So I just need your time to be able to discuss this matter. And I think it was an important lesson for me because I felt that unless the caregiver is educated, it not only affects the care of the patient, but affects the legacy of what is left behind. So one legacy here is such an inspiration for me is you, Priyanka. Although your mother is no longer with us, whatever experience you had, you turned it around to make it a positive experience for yourself and for the community. So I think there's many benefits in this process. I mean, I feel this was a positive journey for me because we got you to help and advocate for our cause. So I think there is more attention that's needed here for the caregiver, for sure. And we need to explore ways to do it together.
Definitely. I mean, especially in a country like India, I haven't really seen a lot of these initiatives, and I'm more than happy, like gratitude to help the community with your support in this. Next question would be, I wanted to understand how a caregiver can effectively advocate the healthcare system to benefit their loved ones throughout the treatment process.
Sure. I think the caregiver can come educated about the disease. I think I honestly feel like blogs and chat groups and Facebook and Instagram, etc. If we are lucky enough to have such a group, this is also a valuable resource for the caregiver to get information, and then approach the medical team in a respectful way, not a challenging way, so as
Right.
not to really offend anybody,
Right.
so that they can learn about the disease. I learn from the caregivers' questions all the time, and they said, "Well, why didn't I get this therapy, and why didn't I get that therapy?" And it's a two-way street. It makes us think. Some of these questions may be so naive that actually it makes us think outside the box. And some of the questions may help us to avoid a wrong move. So it's a two-way communication. I think caregivers need to educate themselves and have an ongoing relationship with the medical team in a respectful, collaborative way, so that you respect somebody's time. I mean, doctors are very busy, especially in India, where there's so many patients. They don't really have the time to go through a huge number of questions. So also blogs and groups like what you're creating will be of value. But I think for some critical questions, you certainly need to ask them, not necessarily just to the doctor, but to the nurse, the fellow or the medical team. But this has to be done. It is a two-way street.
I really like the fact that you mentioned that caregivers should ask a question and not challenge the team. Because,
Right.
most often or not, people in Indian healthcare system are offended by the fact that, caregiver comes and says that, they are blaming people, the doctors, if the patient is not responding well to the treatment. So, definitely having a very sustainable and, peaceful relationship with your medical team is a must to have a better care support for your loved one.
So I think, Priyanka, a lot of our patients have these misgivings. Why was it not found earlier?
Yeah.
And who was at fault for not finding this
Exactly.
earlier? And it's often a situation where we have difficulty accepting the diagnosis. And sometimes we pin it on someone or the other, maybe appropriate or not appropriate. But I think our creative energy should really go towards finding a solution for the problem.
Right.
And those questions can be asked later. And it can be done in a respectful two-way conversation.
Agreed. As we have already mentioned that you keep interacting with numerous amounts of caregivers and patients on a day-to-day basis at your practice. What is some signs you have noticed, and how frequently has that been, to observe a caregiver burnout? Because, this is very common in a cancer journey.
So caregiver burnout is very common. Unfortunately, the patient, for instance, if it's a married couple, the husband and the wife or the spouses are going through probably the most stressful time in their life. And when you're under stress, who will you take it out on? It's typically your loved ones. So I think it's important that the caregiver take care of themselves, avoid a burnout, avoid this blame game. Marriages fall apart, families fall apart because of this high stress that they're undergoing at that time. So it's important to recognize that early and make sure that you find the resources, the caregivers find the resources to help themselves, whether it's, whatever they like, exercise, music, meditation, whatever helps them to get through this difficult phase.
So I still remember last year when my mom was diagnosed with biliary cancer stage 4, I was just transitioning into a new workspace, changing my job, and altogether my roles and responsibility in a professional life as well as personal life flipped. So how do you think, like a caregiver can maintain a balance between their personal as well as professional life, because professional is definitely needed because cancer is a disease which requires a lot of financial resources.
Yes. So Priyanka, you've flown in the airplane before, and remember when they tell you when the oxygen tank comes down, oxygen mask come down, first secure it on yourself and then secure it on the child. So I'm taking care, as you know, of two frail parents. And so I'm
Yes.
going through the same journey as you did last year. You have to take care of yourself so that you would be able to take care of your loved ones better. So I don't know if there's any other way to say it better, but make sure that you reserve your own space so that you can protect yourself and maintain your strength.
Got it. So, any message you have for our Indian caregiver society, because a caregiver mental health is still very untouched in Indian healthcare system. So, do you have any message for them? How should they effectively take care of themselves as well as their loved one?
To be honest with you, the caregiver health management and maintaining their sanity through this process is an evolving area all over the world, not recognized. I'm glad that you in India are actually recognizing it. So I think that, just like I mentioned before, find your space, recognize that it's going to be difficult. You're going through personal challenges, like you mentioned, professionally, you're going through so there will be some sacrifices that have to be made.
Understood.
So, but eventually, I think you don't want to be in a space later on in life where you have some regret for what you could not accomplish earlier. So do the best you can, but meanwhile, make sure that you reserve your own space, because I can guarantee you the patient wants also your welfare, wants to make sure, like your mother would want you to succeed in your profession. So keep that in mind.
Understood.
So Priyanka, let me ask you about your own journey. When you learned about the diagnosis for your mother, first of all, how did you get that information, and how much of it was shared with your mother, both in regards to diagnosis and prognosis?
So, I still remember I received a call from my father on 11th of June saying that my mother has severe jaundice and abdominal pain. She was being admitted at a local facility in my city, and the doctor performed an MRI scan on that. At that point, I was just thinking that this might be pancreatitis, just some infection which went severe. I had no idea about what cholangiocarcinoma is. I had no idea how terminal this cancer is, but my dad got a hint from the doctor over there itself, and he did not share that with us, and he kept all of it to himself until the confirmation was done by a biopsy or a PET scan. My mom was rushed to a tier 1 city, which is Delhi, into a like multi speciality hospital. She underwent all the tests and everything. Throughout this process, me and my father were the one who were visiting the doctors and talking to them, understanding how the criticality of the disease and how terminal it is. We knew that this is a terminal disease, we knew everything about it, but still we were keeping a hope at the back of our head. We were trusting the process. We thought that let's just give it our best try, give her the best form of treatment, give her best exposure to the medical healthcare system, and that's what we decided in our head. And then we did not disclose this information to my mother towards the beginning because we didn't want it to scare her. Her body was frail from the jaundice. She was still recovering. But then ultimately, when her chemotherapy regimen started, she got the hint that this is a cancer, but still she was not aware how terminal it is. She knew that it is a cancer. She will recover, because we wanted to keep her spirits high. But yeah, that's the kind of information we shared with her. Then slowly we started sharing it with our family as well. We ensured that we are not disclosing about her diagnosis to the extended family, because typically people make a lot of stories in Indian society. They come to your home, they talk about how deadly cancer is. We didn't wanted our mother to be exposed with that kind of negative energy. So this is the entire journey. We knew about the prognosis, but we were still, you knew how much I was chasing you and other doctors at the conferences to review my mother's report and give us some hope that some form of clinical treatment which is not even available in India might work for her. So that was the entire journey of diagnosis and prognosis for me.
So, Priyanka, I come from a different type of training where we tell the patient and the family the diagnosis and the prognosis very early. As soon as we know that if somebody has gallbladder cancer and it's stage 4, we discuss that. And so I would tell the patient that yes, this is gallbladder cancer, this is stage 4, this is an advanced disease, and unfortunately, the prognosis of this disease and survival is limited. And you might, if you look at the literature, it's usually less than a year. But the reality is that it's like a bell-shaped curve, and 12 is the median. There are some people who can do much better than that. So let's have hope and let's do the best to overcome it.
Yeah.
So on reflection, what do you think? Should we have shared that information with your mother that this is advanced biliary tract cancer, that prognosis is so and so? Do you think she should have been aware of that from the very beginning or not?
I feel that, given we should have informed her about the prognosis and everything. But at that point, my mom also had a little bit of, like stigma from cancer.
Yes.
So we did not want to scare her. So we were doing it for her own mental benefit. I even had a therapist for her who was trying to, break this news in a better way than us to her. So I think the therapist was doing a good job. He was trying to break the news to her, and slowly she was also getting used to the fact that this is a terminal illness. And by the time, like after 2-3 months of the treatment process, she did realize the fact that this is a terminal illness, and she had come to terms with this, and she was still willing to fight it out. She still wanted to get the best of care and be strong enough to fight this chemo, gemcitabine, which is a very, very hard chemo. She was still going through it. She was trying to go for walks, and she was trying to keep herself active. But I certainly do believe that we should have informed her about all of these things, because managing your personal affairs for a terminally ill patient is something which is very important, I believe.
Sure.
Which is something, I feel if my mom knew about it, she would have done something to manage her own, like the affairs which are not complete yet. So
I think that would be useful. I think your experience would be would be beneficial for others. I mean, if I were having terminal cancer, I would want to know, because then who will take care of my kids? How do I arrange for them financially? I mean, these are things I think every adult wants to take care of. So, Priyanka, you mentioned something about the family and stigma. Do you think it might be possible for the patients or the patient's caregivers to inform these family members in a way so that they don't approach the patient in a negative way, that they have cancer, or break bad news? So, for instance, I know with my own mother, I tell their relatives, if you come and tell her, oh my God, you're doing so poorly, it doesn't help her in any way. So please do that outside before you visit her. But maybe these relatives and caregivers, extended family members, may have some unfinished business they want to talk to your relative about. Some issues that happened in the past, they want to close the chapter, sometimes ask for understanding, or other issues that family members sometimes have with each other. Do you think that we could all do a better job in communicating this to the family so that they are more of a resource and a support for the patient rather than perpetuate the stigma of the diagnosis?
definitely, the question you have raised, this reminds me of something which Patty from Cholangiocarcinoma Foundation, I would like to highlight her. She had been a great support to me, my entire family throughout our cholangiocarcinoma battle. She comes from Cholangiocarcinoma Foundation. So she shared one, snippet with me of an article that highlighted on the fact that, how you should prepare the visitors who are coming to your house to visit a patient in hospice or end of life care. These are the questions. You have to accept the fact that, they also love your loved one, and they also would like to see them, have some share of time with them. So you have to offer them that kind of time, because that's their relation with the loved one who is dealing with the terminal battle. So that is definitely, that has to be there. But on the hindsight, ensure like you communicate in upfront, like you said, that you don't have to discuss how terminal this is, you don't have to discuss how frail that person is looking. Same case happened with me. Like, there were a lot of relatives who would come and visit my mother, and at times she was bedridden and in a vegetative state. So the people would say things like, you are very, very weak right now, what has happened, etc. I made a point before they entered the room that, don't talk about her fitness or, her health at all. You just have to give her positive vibes that she is doing okay, she will be fine. So this is what I, encourage people to do. And this is what, because, it's about the mentality, psychology, it's all in your mind. What you feed into the patient's brain, that is something their body will consume, and that's how they will react to it. So, definitely we have to develop a very positive environment around a person who's undergoing a treatment or a hospice care.
So I think that's your experience is, I think, very educational for all of us, Priyanka, because I think, as a patient, the patient may want to talk to some family members. Maybe there's a relationship that was broken a long time ago. This is the time that they want to repair that situation. So I think we should give them that opportunity. But like you did, with your experience, educate them in advance that this is not for them to reinforce how difficult the situation is, but to hopefully build a positive environment, so which will be good for them, good for the patient, and for the relatives. So, because I often think of the legacy of what is left behind after the patient. It should be a positive legacy.
Agreed. Yeah, and to the fact that, how the caregivers should be communicated the information, educated. This is why, we at Zarurat Care Foundation are actively advocating to talk to the caregivers, explaining them the complexity of the disease. This is something I learned from Cholangiocarcinoma Foundation. Like, that's what they inform me, that whenever any diagnosis happen, the caregiver is connected, like the oncologist team, like you guys, they connect the caregiver to a specific care group, who are the ones who will be helping them throughout understanding the diagnosis, prognosis, and everything, the decision making. So this is the kind of system I want to establish via Zarurat Care Foundation in India, because people over here certainly are at a lack of exposure to the cancer complexities. So definitely we want to help them with every regards of that.
So I'm really all the kudos to you and Ayush for doing this with Zarurat Care. And I think there are many advantages in the Indian system. In the Indian system, you have a very strong family structure, right? Often you have parents, grandparents, grandchildren, they all live in the same household sometimes. You have a very big interconnected families and cousins and uncles and aunts. This sort of strong family doesn't exist in the West often, unfortunately. So I think there's a lot of resources here in India that are not available in the West. So I think we can use these to the advantage of our patient. So Priyanka, I want to ask you, as a caregiver, how did you manage your life? How did you establish your routine? How did you take care of yourself?
So, firstly, caregiver, for every caregiver, we hear you. We do know it's a very tough battle, but just be in there and believe the process. It's a hard journey. It was very hard for me, especially because I was living in a different state altogether. I had to take a flight back and forth to visit my mother, also manage the new job I had transitioned into. So it was a very difficult process. But like for me, my intention, my clear goal was to give best of treatment to my mother. So every other emotion I was getting was a secondary emotion. Every other thought of her dealing with a terminal illness was a secondary emotion for me. My primary objective was, whatever she's going through, I have to subside her pain. I have to ensure she's at the best of comfort and she feels the best when she family is around us. So this was my primary objective, and I used to feel good. I used to just sit with her. My morning routine, when I went back home, I took a 1 month, 2 month, work from home from my office. I was very fortunate to have colleagues who were, allowing me to work from home. I was there with my mother. I used to, wake her up in the morning. I would sit with her and, chant some mantras, and, like we would do yoga together. We will sip in tea together. I was ensuring that I'm spending as much of quality time as possible with her. I would eat with her. I would cook with her. She used to love the food I would cook with her for her. I had curated certain meals for her, so recipes which she would like, given her diagnosis and treatment at that time. So those were the little things we were enjoying. I would take her on drive whenever she was feeling a little weak or upset. So these were the things which was giving me pleasure. And definitely, when my mom's diagnosis happened, that was the point when me and Ayush decided that we have to start Zarurat Care Foundation. I remember I was struggling to find the right doctors in the community, and I was reaching out to a lot of people when Ayush told me that, why don't you create a NGO for this? I have been inspired seeing what you've been doing and resources you've been pulling together. So this led to the foundation of Zarurat Care Foundation, and that's when we started. And at that time we were just in the registration process, doing all the filing and registration work. But yeah, this is when Zarurat Care Foundation also started, and I was just trying to divert all my energies into building this and giving my mom the best of care and comfort.
So coming to some practical issues, Priyanka, like how does the caregiver approach the patient about, say, estate planning, financial matters, because they're dealing with maybe a life-threatening illness. So when do they do it, and what can you go by your own experience, or what suggestions you may have?
So regarding the affairs planning and financial planning, we didn't really discuss that with our mother, because, I think in India, the healthcare system is extremely good. We are fortunate to, have her treated in a country like India where, government has provided so many resources. So my mother was a government employee, and, her entire treatment, including the immunotherapy, was sponsored by government. So, most of the bills were taken care of, which was extremely good. And we were fortunate to have be in that kind of healthcare system. And other than that, any kind of affairs, my dad wanted us to discuss it with him rather than my mother, because, again, out of love, he didn't wanted her to take any stress during that journey. So, that's what, as you mentioned, in India, we have a wide, family, unlike in the Western countries. So you have a lot of people to share the burden and resources with, rather than just talking to the patient who is already undergoing a lot in their journey.
Yeah, so I'll tell you my own experiences. I have a will and I have an estate plan, and I think earlier people do it the better, because it's often not a good idea to wait till the ultimate event. But I often tell patients that regardless of whether you have a curable malignancy or a difficult malignancy which is not going to be cured, it's good to have that, so that you create a peace of mind for your family. So there's no problem afterwards, between your family members, etc. Make your wishes known in advance. Um, I think you were lucky in the setup that you have. But I think not everybody has that ability, or in
Right.
India or rest of the world. So you would agree that it's at some point they have to make the decision, and not, say, for instance, a head of household,
Okay.
and not leave it to the other family members.
Yeah. I mean, I definitely agree. Over the course of when we started Zarurat Care Foundation, I have had the chance to interact with a lot of caregivers who are dealing with terminal illness with their loved ones. So, most of them are hailing from very, below poverty line strata of Indian society. And it's very, very hard for them to even manage a supportive care for their loved one. And at that point in time, they have to make a very hard call to switch from the curative to supportive care. And it's a extremely heart-wrenching process for entire family, because they know that out of resources. I was talking to one of the doctor oncologists from my own city. I come from a tier 2 city in India, which does not have a lot of good onco facilities, but there has been a doctor who has been trying to initiate those facilities there. And he mentioned the fact that you cannot stress upon things like immunotherapy, genetic sequencing, which is something that is advancing and bringing curative treatment for biliary cancer. But in this city, people are struggling to even pay for a biopsy. They do FNP, which is a fine needle process to just detect if it's a cancer or not. And they can't even afford to have a follow-up CT scan or PET scan, so they can just be put up under chemotherapy for as long as they can pay or the government is willing to pay. After that, they have to make a very difficult call to switch them from the curative to supportive care.
So let me go to a more difficult question, Priyanka.
Yeah.
Unfortunately, I know that your mother's journey came to an end.
Yeah.
How did you deal with the process of, mortality and death, and afterwards? How did you cope with yourself, your dad, and your family?
I mean, see, till the end of the process, we were hoping. I remember got on a call with you. I was hoping that we will be able to pull it off, find some treatment for her. I still remember we were discussing some, clinical treatment for her, and we had put her up on that. But, it was too late because her cancer was already extremely advanced. So, I mean, I do understand that it's a very hard call, but we were still thinking that we will put her up in a curative kind of setup. We were taking her back to our hometown where we had discussed with the hospital to give her proper supportive care and everything. But on our way back, incidences happened, and unfortunately we had to rush her back to the hospital in Delhi, where she was put up in ICU for 2 days. And the doctor had already told us that it's the end, you are just wasting time. If you are putting her up in a ventilator, it's just a waste of money and time, and she's undergoing a lot of pain. At that point, I was just praying that let her away from the pain. My brother came to me screaming that why are you even putting her up in ventilator, she's already gone. She is gone, you don't have to give her more pain, just let her pass away in peace. At that point, when we were struggling in the hospital, I remember it was a Christmas evening, and it was very hard for us to digest, but we were just hoping that her pass away is easier. We don't want to give her more and more pain now. The doctors over there themselves told us that आंटी जी की तबीयत अब बहुत ख़राब हो चुकी है, don't give her any pain, don't bother her, please let her just lay down in peace and her body will take care of everything. So that was our call. She passed away peacefully on 25th Christmas morning. Christmas used to be my favorite festival of the year, best time of the year, but the events that led to it, and what I did at that point when we got to know about her passing away, I just went to a shop, bought her an extremely pretty kurta pajama, so that because we had to give some clothes to the hospital people for her body to wear. I bought her that. I bought her white flowers because she loved that. And that was my final thing to do. And then we took her back and we did all the cremation and everything. It was actually my brother's birthday on 26th December when we did the cremation. So it was even harder for my brother. On the day he was born, he's doing all the cremation and all the processes for his mother. So it was very hard. I had to ensure I'm taking care of my dad and my brother. We were fortunate to have an extended family who was taking care of us. Everyone was there in the process. My mother was so loved by everyone that there were like 1,000 people in her cremation ground. So, that was something she left a mark with. So, yeah, it was a hard process. After the 12-day mourning process, I realized we have to definitely put everything up, all of our family members into therapy, because everyone went through a lot of trauma. So PTSD was one thing which we were all dealing with. So that was something which I actively took up. I had put my brother, my father, everyone into therapy. We are still grieving, but for me the grieving ends when I begin to work for Jarurat Care Foundation. Whenever I'm grieving, I'm working for Jarurat Care. That helps me with my grieving. So this is why we are here.
That's a wonderful story, Priyanka, and I'm amazed you can tell this story maintaining your composure, because it's a fabulous story. Finally, I want to ask you, Priyanka, how do you take care of yourself now after the event?
After the event, I firstly, me, my brother, and my dad, when we came to Mumbai after we wrapped up all the process, we firstly went for our full body checkup. Because our body ourselves went through a lot of stress during that time. We were not eating well, not sleeping well. So we wanted to ensure what mistake had happened in past, we are not going to repeat it. We ensured that we are going to do and semi-annual full body checkup for everyone. I have even started taking all kinds of tests, be it pap smear, to ensure there is nothing wrong with the body. In fact, yesterday was my full body checkup. I went through the full body checkup. So that is one thing I'm doing. I have started, over my entire journey, I have started to realize the fact that, I am alone being able to manage my own affairs and states. So I think that is something which is very, very beneficial. I'm able to tackle all with all of my emotions and everything. So yeah, this was the process. I'm able to deal with my emotions well. I try to do yoga. I try to remember my mother. I try to, like, she comes in my dreams most often every night. I try to sleep a lot because I feel good sleeping because she comes in my dreams. So that is something I really like. This is why I've been sleeping a lot lately. But yeah, this is something, it's hard to manage, but, just keeping her happy memories, keeping her in my mind, and, sharing her happy memories with my aunts and uncles and family. That's what makes me feel happy.
Thank you, Priyanka. This was really a wonderful story, what you just described about your mother and your family. I think what I've learned through this process, after speaking to you, is that it's important that the caregiver take care of themselves. I feel it's also important that we should be frank, candid with the patient, so that they can make their plans, engage our extended family, the resources that we're fortunate to have in India. In India, not every patient has the access to complicated treatments and diagnosis, but they have great access to their resources within their family. They have access to spirituality, they have access to yoga, so many other things that can help them. And then eventually, even after the patient hopefully recovers, or if the patient passes away, we deal with it in a positive way, so that we can impact both the disease as well as ourselves and the family members. So I think I've learned a lot from this interview, and I thank you again for both inviting me and for being so honest with your own experience.
Thank you, Dr. Javle, for giving in your time and also the endless support you have offered to us and Jarurat Care Foundation. We are very, very fortunate and glad to have you on board with us. Thank you.
Thank you.